Yeah, so when I think of NAT, I don't think of medicine actually. I think of lifestyle.
Mm.
It's really a lifestyle or a sort of a therapy program. That's the best way I would consider it. And so whenever you have a therapy program or a lifestyle program, it's very holistic. It involves the mind, body, and the energy of the body, and your behaviors with others, etc. And so, with that in being in mind, if there's any abnormality in any of those issues, including your behavior, your physiology of your body, and etc., uh, this technique can help address any of those. So, I'm pretty sure pretty much everyone can benefit from this technique in some way. Um, and essentially, the way it works is that it sort of resets your energetic system in your body. So, if you are taking medication or if you are on a certain diet, that's great. But if you have a sensitivity to that diet or if you have a sensitivity to that medication, those things can actually harm you. So, in other words, these sort of changes we make in our lifestyle with our food and diet and medication, that is not really the answer in our philosophy with NAT. The answer is your own body, the way you react to things on the outside. And if you can correct the way your body responds to extra inputs, then you can sort of self correct for those issues and you can achieve homeostasis. So if a medication is causing a rash for a patient, let's say, but that medication is absolutely necessary for a certain condition, you can use NAT so that you can continue taking the medication and not have the rash.
Mm.
Likewise, if your body does well eating let's say a vegan diet, but for some reason your body does not do as well when you're on a vegan diet health wise, you can use NAT to sort of help your body assimilate those nutrients with the
Mm.
vegan diet better. So it can apply to many different situations.
So it sounds like it really helps with rebooting metabolism.
Yes, that's a good way of
That's the
describing.
first thing that comes to mind as you're talking in my own experience with using
Right.
it over the years, is that it really goes to metabolism and improving cellular respiration, oxidative phosphorylation, etc. Right?
Yeah, so when I talk to my patients, often I will describe the analogy of a computer.
Mm.
So if there's a problem with your computer, like we were just having with our Zoom meeting here, what did we do? We turned off the phone and turned it back on, and all of a sudden the Zoom meeting works. So just like magic, that's the same thing with the body. So if there's a backache that you're experiencing, we try to target what's causing that hang up, and we reset your body so that the next time it loads up, the energy of it, it disregards that stimulus and sort of lives as normal as best we can. Sometimes it requires multiple treatments, and it is a longer process than just taking a pill. So people should not expect an overnight cure. But the beautiful thing, as I was going to say, is that there's very minimal side effects. It's very natural, and it's, as I said, very holistic. So including resolving the backache, you'll often feel that your sleep improves. You're able to breathe better. You're able to not get angry with when someone attacks you, etc. It's really amazing, actually. It's a whole system.
Sounds really great. So, a week or so ago, we were having a conversation about coronavirus, SARS-CoV-2, named publicly COVID-19, and you were sharing with me how your family members and you yourself contracted COVID-19, and you all recovered from it. So, how did you recover so quickly?
Yeah, so since then, actually, since I talked to you, we actually found out from the CDC that there was a contractor working in our building, my wife's building, who, by the way, is graduated from Youngstown, UCOM, and she practices internal medicine in an office building, first floor. And there was a contractor in that floor that had it. It was proven positive for the test. So I think that's where she got it. And then eventually my son and I also had it. And what happened was my son, who's 9 years old and who loves NAT, he thinks I'm a Jedi Knight, basically, wants to do everything that we do. And he and I both were into NAT and we did our treatments for it. There's actually a saliva treatment
Hmm.
which, by the way, there will be a link, I believe, that you'll post where guests can get that access to that, especially
Absolutely.
for this program. And that I just followed that, essentially, that treatment method. And my son and I did really well and recovered really quickly. My wife, who's quite busy, working all day, didn't have time to actually do the treatment so much, but she was getting sicker and sicker to the point where we actually had to take her to the hospital. So instead of taking her to the hospital, I told her, why don't we try this technique, NAT? So she said, sure, let's do it. So I gave her the same treatment. This is a few days later. And then she again got better. I had to do a couple more treatments for her. For some reason, her system, I think, was more sensitive to the virus than me and my son. But generally speaking, I did a few treatments for her, and she got better. And that was about 3 weeks ago, and we're completely fine now, thank God. And so that the NAT really saved us. If I was older, or if I was a smoker, or if I had lung disease or heart disease, it might be more difficult for me, for sure. So I cannot say I give a guarantee, but I do think this technique would help even those individuals. So I think it is sort of, it also provides that answer, by the way, to a question which the government has currently, which is why is a patient A and B the same age of both? Patient A gets really sick with it, and patient B does not. They don't have that explanation. And I think this idea of individual susceptibility and addressing your own immune system, like we talked about, addressing your own mind, your stress levels, doing meditation, pranayam, etc., that can help you as well. I think I was telling you as well, Guruji, that last week, that if you practice your meditation and breathing capacity, expanding your lung capacity with breathing exercises, you can also survive better with this virus. I do believe that as well.
Absolutely. And you mentioned the immune system. And so we're working with some people in our community who've contracted it and recovered in most in under 72 hours. But it's because we really have been focusing with these individuals who've gone through some of our training on strengthening the immune system.
Yes.
And you just said it, from one individual to another, some people's immune systems are stronger, but some people's immune systems are very weak and already compromised.
Yes.
And those are the people who are, I think, going to be more susceptible
Right.
overall. So, but this is, viewers, make sure, I'm going to remind every one of you again at the end, we have a link on this page where you're going to be able to link through, and you're going to be able to view the steps to take to do the actual saliva treatment that Dr. Roy's been talking about, that you can do both to protect yourself from COVID-19, and if you think you have symptoms, to get rid of them. It's really powerful. It really works. A number of people, based on the NAET approach, have used this saliva technique, and you're going to be able to see it and be able to put it into practice right away. And so before I get to my last question, I just want to thank you for giving us that link. It's so valuable. I saw the video myself. It reminded me of years ago when I was having problems with poison ivy. It was like if I wasn't within 2 feet of poison ivy, I would get poison ivy. Poison ivy loved me, and I used poison ivy in a glass jar as I was instructed through NAET techniques to immunize myself from poison ivy. I've never had it since then, even when trekking, walking through trails, getting brushed with poison ivy plants. I've never ever contracted it again since using this method. So it's really powerful. It really works, for sure.
Yes. So speaking of that, there is the technique that we're showing on the video is sort of a self-balancing procedure, which is very safe and doesn't cause any much side effect. There is a more intensive procedure, which is really the NAT that we talk about, and that's done by licensed practitioners or certified practitioners, and that's a bit more dangerous to do that technique. You have to really know what you're doing when you're doing that. People can have reactions to that. So that's why that technique is reserved for people when we train them properly. And so it's not the same exact technique. But this one that we provide, as well as there's a PDF copy, informational booklet that Dr. Devi actually herself wrote, and your viewers will actually have access to that as well, describes a self-balancing acupressure technique, which is safe.
Yes, wonderful. So